This is Black Mental Health Matters. I'm drkerryann Williams. I'm a psychiatrist and the host of this podcast. Today's guest is Dr. Alecia Greenlee. Dr. Greenlee is a board-certified psychiatrist specializing in reproductive and lifestyle psychiatry. She's dedicated to centering the mental wellness of women through comprehensive integrative care. She has a particular expertise in ADHD and how hormonal fluctuations can influence what ADHD looks like in women. Her work addresses the intersection of ADHD with perfectionism, emotional overwhelm, and the sociocultural pressures that many high-achieving women navigate daily. So welcome to the show, Dr. Greenlee.
Thanks, Dr. Williams. Thanks for having me.
Tell us a little bit more about yourself and your work.
Sure. Yeah. So like you said, I'm an adult psychiatrist and I practice in the state of California. I have a private practice. And then I also do some consulting work at the Bay Area ADHD Center, where I do a lot of diagnostic evaluations as well as treatment, including medications, as well as therapy for people who have ADHD, as well as co-occurring diagnoses.
Okay. So one of the reasons that I brought you on the show today was to talk about ADHD. You know, this has been actually a hot topic in the news. I know that a lot of times I scroll on my news feed, and I've been seeing a lot of articles pop up about ADHD. And so I thought this would be a really great thing to kind of talk about today. I mean, people have different ideas about what ADHD is. People tend to say, oh, I'm so ADHD, or they think, well, I can't focus, I must have ADHD. What is ADHD?
Well, ADHD does have specific diagnostic criteria. I won't go over the details of it, but you have to have a significant number of those criteria in order to be diagnosed with ADHD. There are about 3 different types. There's inattentive type, there's combined, as well as hyperactivity. So when you have a combination of these symptoms is when someone has ADHD. And that usually includes a certain amount of impulsivity. So you might be engaging in behavior that could be potentially risky, or it could be something as like a child at home is like more likely to kind of like run out the house or do something they're not supposed to do, as well as like really struggling with your attention span. So really struggling with kind of maintaining your attention and doing activities that require a significant amount of mental effort. We really think of it as like kind of an executive function disorder. So it's not something that turns on and turns off. I know a lot of people say like, I'm acting very ADHD today. It could be you just have that particularly, it could be rough and you could be having attention issues, but ADHD has a specific number of criteria that an individual has to meet to have that diagnosis. And it requires a pretty thorough diagnostic evaluation that includes some psychological testing skills that are utilized, a clinical interview, collateral information that's collected either from family or from friends, as well as like a history of having these issues at least before the age of 12, like we're diagnosing adults. There can be a worsening of symptoms that does happen over time, which is what I spend a lot of my work doing when working with women who start to notice in reproductive age, they're struggling more with some of these symptoms, as well as during perimenopause. But again, you really do have to have this like kind of chronic history of having attention, concentration issues, having sometimes impulsivity, as well as hyperactivity symptoms.
Okay, so it's not something that just starts when you're an adult.
No. Yeah, no, it's not something that starts when you're adult is what we know so far. I mean, of course, there's some people who might have a traumatic brain injury, and following that traumatic brain injury, they could start to have symptoms of ADHD. And so you might say that's an acquired form, but pretty much outside of that, this is going to be something that's long-term. Because again, it is a neurodevelopmental disorder that impacts someone's executive function. So how you make decisions is like a huge piece of ADHD. It's not just, performance at work or performance at school. It is something that is impacting multiple facets of an individual's life. And it's something that I think we really need to take more seriously. So that's why I'm here today.
So I noticed you use a term executive functioning. What are some examples of things that make up executive functioning?
Yeah. So executive functioning would include things like planning. So can you plan for the future? Can you plan say example, like something that requires multiple steps. So you want to go on vacation. Okay, you need to book a hotel, you need to book the flight, you need to pick the dates that you're going, who's all going to come with you, how much money to spend. That's one example of like a task that requires some executive function. It also includes being able to inhibit yourself in response to stressful situations. So for example, it may be that you're upset about something. So rather than like you lash out at someone, you kind of can collect your thoughts and respond in an appropriate manner, as opposed to getting into arguments or physical altercations with people. Things escalate further. It's also motivation. Like, how do you self-motivate? How do you get yourself going each day, or a task that you absolutely know you need to do, getting started to doing that as well. So it requires that, as well as time management skills. Like, how do you decide how long it takes you to get to an appointment? Like, do you factor in traffic? Do you all of these decisions are all like kind of executive function, kind of examples of executive function that I spend a lot of time talking with patients about.
Oh, and so in particular, you have been able to look at ADHD in women. And so tell us a little bit about why ADHD in women might be a particular area of focus. Why is that important?
The reason why I specifically think about the women that I work with is because a lot of them had symptoms of ADHD in childhood that were missed. And this is thought to be because we believe that girls may have less of the externalizing behaviors that we sometimes see in boys and we attribute to ADHD, such as, in the classroom, can't stay in your seat, fidgety, aggressive behavior, speaking out of turn. A lot of times we don't see that so much in girls. We see more of the inattentive symptoms. So maybe they're like kind of just sitting there and staring off, but they're not like really listening, and they're missing, pieces of the lecture. But that's not disruptive to most other people. So it often doesn't get diagnosed unless people are having kind of like extreme kind of milestone kind of like gaps along the way, right? So like start to struggle in school. That's when people are like, oh, we probably should get them assessed and figure out if this could be something that's going on. And I will say, unfortunately, a lot of them still get misdiagnosed as like, oh, you have anxiety. She's just feeling a bit overwhelmed by this environment. Or, oh, she's just really sad. When in reality, it's like you kind of start to even then begin to feel that demoralization that we see in adults. And what I see in adult women working with, when they look back, they feel like, oh, yeah, I'm just not good at math. Like, that might be that one stereotype. When it's like, when we think about math, right? Again, several steps to get to the answer of a math problem, right? And as you get further and further up in math, that becomes even more of a reality, right? It's not just 1 + 1, it's 1x plus 2 plus. So that's just an example. So that's why I spend a lot of time with women, because a lot of them don't even know that this could be something that's going on. And so a lot of times people are coming to me because they're struggling with work, or they're struggling at home. They're feeling kind of more irritable, easily frustrated, have tried, every antidepressant out there. And then when we actually go back, take time to hear their story from childhood and beyond, what we often find, oh, this stuff was there all along. But a lot of times no one was like really bothered by them. And they thought, well, I just like to daydream, or I just like to, I would get bored really easily. So then, no big deal. That's on me. I need to work on my discipline and focusing on the work that's in front of me and not be so daydreaming. So a lot of people then internalize that and really take it in as character flaws, as opposed to this separate ADHD diagnosis. And so for me, a lot of the times it's actually helping them to reframe some of that. And it's really like amazing to see like, oh, this is how my life can be after I get treatment for ADHD. And I really just enjoy that work and seeing like the outcomes from that.
Wow. It's, as you talked about ADHD in girls, I think about my experience as a child psychiatrist as well, and kind of how it can be missed, particularly in, girls that are highly intelligent as well.
Yes. Yeah.
Because depending on the school they're in or the supports they have, as long as they're getting good grades, there is no problem, right? They're like, oh,
Right.
fine. And then, as you
Right.
mentioned, as they get into high school, as they start getting into college, and there's multiple steps and there's a lot of organization that's required, then
And less
suddenly they begin
structure.
to wonder, what's wrong with me? I used to get good grades. Why is it so much harder? And sometimes what we notice, or what I kind of notice when in my work as well, is that people didn't realize how much time they were taking to do their homework. They were taking twice as long to complete the same work, even though they got a good grade. And after a while, that was not really a good strategy
It's not
anymore.
sustainable.
They didn't realize that they were kind of inefficient, basically. Like, they were getting the final result, but their efficiency with how they did it was maybe not that efficient. Or once it got more complex, and suddenly they started feeling more lost. They started getting more anxious. They started getting more depressed.
Or that volume of information increases substantially when you get to college and then grad school, right? It's like the volume is so it's so big. There's no way you have the efficiency to get all that work done in order to maintain the fund of knowledge you need to go further ahead. And so again, I think in the field of psychiatry, we aren't taught that, right? We aren't taught someone actually can go their whole life and have this diagnosis and it be missed, right? And I remember when I was on one of my pediatric rotations as a medical student, and I brought this up. I said, well, is there, what is the data around the number of kids who have learning disabilities that are missed, or who have ADHD that are missed? Oh, that's not a thing. They catch it because there's this, and I'm like, are you sure? Because in the population I grew up with, a lot. Yeah, that happens all the time. And that's what I learned later on. I was like, oh, okay. I was in a very different population that I grew up with in that particular rotation. I was like, well, maybe in that environment, that's true. But where we grew up, it was not the case, right? It was a lot of kids probably had these learning disabilities, ADHD, that were being missed because no one was really paying attention, right? Because our parents are occupied with working, they're doing the best they can, and education around mental health, right, wasn't really something that was pushed in those communities, as well as it was something, unfortunately, psychiatry has to reckon with some of its past history. It was a abuse of power that was utilized against Black and Brown communities historically, right? And so for me to be a Black psychiatrist, is one of the things is I want to reckon some of this and actually let's take the parts of this that are actually useful to us. Let's actually begin to address some of this, because what I do still see is that I do have some of my women patients who were diagnosed as girls. And they are saying, oh, well, my mom didn't want me to take this medication because there was concern or fear of that it was going to mess my brain up. And I just needed to basically work harder, not to worry about that. And then they look back and they're like, oh, well, maybe I wouldn't have had some of these health problems that I have today. Right. And so that's just a very sad kind of way to kind of view this, right? Is that, oh, you just need to work a little harder and taking medications is bad. But we wouldn't say the same thing if you had diabetes and you needed insulin, right? You would absolutely say you need to take it. And I don't want to push that it's just medication, but that is a very critical piece to the puzzle with ADHD and managing a lot of the symptoms and being able to stay with the fund of knowledge of how much information is coming in as you get higher up. But yeah, I completely agree with you that there are a lot of these people who were very smart, very intelligent, and then they get to college where there's less structure. There's a lot of choices. Again, executive functioning. What should I do right now? Also, is college where you're first time on your own for a lot of people, figuring out how to manage your time. Again, executive function. And so you add, again, ADHD to that. And it's people really, really can start to struggle with being able to maintain the same level of function they had in high school when there was more structure, maybe less volume of information coming in.
Yeah. I guess I wanted to, bring in that intersection of Black women And how that affects either the giving of the diagnosis or the kind of how people see themselves, or, that kind of, how does that additional intersection influence the diagnosis? I know sometimes we see in child psychiatry with like Black students is the diagnosis is missed sometimes because their presentation is attributed to other things, particularly if as you mentioned, like they can't control their impulses, or they may be more emotionally expressive when they feel overwhelmed. It's kind of just distracting. People kind of attribute their presentation to other things. They're not always seen as, well, I wonder if maybe they're having an executive function problem and maybe it's ADHD. It's kind of more, I wonder if it's a character flaw. They need to behave. And so I wonder, for the women that you work with, how does race intersect with the ADHD diagnosis?
Oh, I think it's a huge piece of it. I think part of it is, again, this unfortunate stereotype, especially for Black women, like you just need to work hard and you just need to kind of figure things out on your own. And again, think of girls, inattentive type, figuring out on your own. It's because you're like doing that all the time, right? You're figuring it out all the time because you don't want to tell anyone that like you actually didn't get the info, that you actually don't know what's happening right now. And so when you carry that through to adulthood, that can be very problematic, right? In not just, again, the fund of knowledge or performance at work, but in relationships. Like, I'm struggling. How do I do this? But also, I think, unfortunately, there's still a lot of bias in healthcare. There's still a lot of assumption that you must be medication seeking when you come in. Again, for Black people, I think it's like, oh, you're just here, you're abusing substances. When I see often the opposite of that, for me, I'm often like, no, take this medication. Like, I think it'll help. I really do think it'll help. And if you're worried about stimulants, there are non-stimulants. We can do that too. Like, we can figure that out. But again, I do think we kind of land at this axis of inequity. So as a woman, as a Black woman, and you are being made to feel like your performance at work, maybe you're not doing so well there. Oh, that's just because, Black people aren't that smart. Well, how did you get here in the first place? So then we end up having to do a lot of work around rebuilding people's like self-esteem once they started treatment, right? And so addressing some of the very kind of this history of like having multiple failures along the way that they then attribute to then, oh, I just need to work harder, is something on my part that I have control over. And so that is another, I think, big part of the picture. But yeah, the biggest thing I would say is like these stereotypes in which Black women get pigeonholed to, where you might be viewed as the angry Black woman, when in reality is like you're the irritable woman who has ADHD and is really struggling to kind of keep up with the work or keep up with stuff at home. Or you really get frustrated when people come in and distract you from what you're trying to do. And so maybe parenting is really hard, or relationships are really hard. You might be more inclined to kind of being impulsive and wanting to terminate relationships. And that's some of the work that I end up doing. I'm thinking of a few clients where they had thought like, maybe I should end my marriage and then all this will be better. Well, actually, what happened is she had ADHD and so did her husband, right? So now you have two people who have executive function challenges and ended up having children who also have like ADHD as well. So, and that's very common, again, because of just the genetic kind of predisposition with this diagnosis. But they were able to both get their own treatment, come together in couples therapy, get things better, and able to stay married, take care of their kids, all these things. And of course, it doesn't always work out that way. But like, I want people to know that that could be what's going on, that it's not that like this relationship needs to end, or it's not that like your partner doesn't get what you're saying. They may not be paying attention, not because they don't want to, but because they're really struggling to try to do so. I hope that clearly answers the question.
There's a lot of kind of issues that you've worked with individuals on related to ADHD. And, one of the issues was perfectionism. And I was curious to know a little bit more about Is it that ADHD can manifest or cause people to feel like they need to focus on perfectionism, or how does that kind of intersect?
So what I'm like finding more of, and they're starting to, I think there is some actual research supporting this now, is that some people who have had ADHD most of their life and it's been untreated often have co-occurring anxiety. That anxiety sometimes plays out as perfectionism. Okay, so in order to compensate for my time management skills, I show up an hour early. Right. So I'm going to be there before everyone else. Oh, in order to address kind of my fund of knowledge issues, I'm just going to like stay up super late and my sleep will suffer because of it, but I'm going to stay up really late and we'll learn the material. I'm going to rehearse it over and over and over again. So there's some kind of belief that like people who have this kind of co-occurring anxiety that shows up as perfectionism, that probably actually gets you through a lot of living with ADHD that's untreated. And so it's interesting because sometimes what I see is like people will say, oh, my anxiety is a lot better because they went and got treatment for the anxiety, but I'm really struggling like with being motivated. Well, a lot of times we go back, we figure out you have ADHD. They do have it. We treat the ADHD, and then some of that anxiety kind of starts to calm down, settle down. Some of that perfectionistic ways also start to settle. I will say this with the perfectionism, it's almost like a habit or a ritual that you're engaging in on a daily activity. And so it's sometimes more than just medication that gets that better. That often does also require a certain level of therapy, right? Because again, it's often rebuilding your self-esteem to understand that like a lot of these past kind of issues that you had was probably related to this untreated diagnosis. And now that it's addressed, you can spend some time looking back and seeing like, oh, wow, I wish I knew at that point that I had ADHD when I was thinking about disenrolling from school. I wish I knew like I had untreated ADHD when I was in that relationship with this person or that job where I felt overwhelmed. In reality, it was I needed more support. And I needed to make the modifications in terms of how I was seeing things and the accommodations probably, and I would have actually been able to make it. So there ends up being a lot of kind of work around kind of feelings of guilt and shame that have been existing related to the ADHD and just the demoralization of living with these symptoms for a long time.
If someone is listening and they're thinking, I want to be assessed for ADHD, what should they know about assessment? What should they know about treatment? Yes. Where could they go?
So most areas of the country, there are ADHD kind of regional like centers where you can get an assessment. It could be done by a psychologist. It can be done by a psychiatrist. It's usually going to require more than a 15-minute visit. And I say that because there are some online platforms that have really made a ton of money off of diagnosing people with ADHD by just filling out a questionnaire and then, that takes 15 minutes. But it really should be a thorough assessment of kind of a lifespan of symptoms is really what you want to be focusing on. And so I would say this, if you're trying to utilize your insurance, the best way to go about doing that is probably start with your primary care and requesting a psychiatric evaluation. And from there, the psychiatrist can then kind of begin the diagnosis process. It requires a clinical interview. It may require additional follow-up. Hopefully the person has had additional training in ADHD. And I would say, most people who are child adolescent trained psychiatrists have that skill. And some of the like kind of younger psychiatrists are starting to have more of that teaching in their residency programs. And so I would say that's one way. And then if you are not dependent on having to use your insurance, like you have the ability to use private pay, there are a number of people in private practice who do perform ADHD evaluations. And again, that could be a psychologist, a psychiatrist, it could be a neuropsychologist who does additional testing. But I would be leery of any place where the evaluation is less than an hour long. And it usually will probably require like at least an hour-long appointment to begin with maybe a couple of additional follow-up appointments.
And what is the treatment for ADHD?
Yeah. So the treatment, I would say a couple things. So first is I think being educated about the diagnosis and know what it is. And so there are tons of books out there. There's podcasts, all sorts of stuff. I really like Russell Barkley, who is a psychologist. He's now retired, but he has a whole channel where he talks about ADHD diagnosis and the repercussions of living with untreated ADHD. And I believe he has it himself, as well as a twin brother who died in a car accident because he attributes it to ADHD. So that's a good resource for free knowledge of actual treatment. Once you have the diagnosis, is medication is one arm. So there's stimulant medications, there's non-stimulant medications. If you're concerned about the use of stimulants, which with those, there is a risk of being habit forming or potentially addictive. And then the other arm, I would say, are therapies or coaching that people with ADHD can benefit from. So again, some of that executive function coaching, time management, kind of inhibiting yourself when you want to respond. You ready to go off on someone? Yeah, like you can't always do that at work, right? You need to keep your job. So really working on through that. But again, some of the self-esteem stuff. And I would say, I do see a lot of people who have ADHD and PTSD. And so sometimes addressing issues related to trauma, I think are important. And then the next piece is going to be probably making accommodations just even for yourself in terms of the reality of like where your limitations lie, right? Like it may not be that you're someone who can do the carpool drop off and get yourself to work on time. And like maybe you just, I can take my kid to school and I can get myself to work and being okay with that. So not always feeling like you have to be engaged in the same neurotypical way as everyone else, and reckoning with that. And of course, making adjustments in terms of like your community supports and things of that nature. And then the last thing I would say is you start to hopefully make some of the lifestyle modifications that you may not have been able to be engaged in. So that means consistent exercise, healthy like nutrition, engaging in social activities like with friends or family, because sometimes it can be hard to pay attention to what people are saying. And a lot of people with untreated ADHD often do, again, have a lot of terminations in their relationships. So ending of friendships over the years because of certain behaviors. So hopefully working on also those areas, as well as sleep is another huge, huge area where I spend a lot of time with the patients that I work with around their sleep hygiene and like trying to make themselves get to bed on time and wake up on time.
Okay. I mean, so it sounds like it's, something that would be thoroughly assessed, something that has a very well-established kind of treatment plan. As kind of thinking of introducing kind of a bit of a provocative question or a provocative issue, which is, there is in some of the news, there's sometimes some skepticism about individuals kind of seeking out a diagnosis of ADHD. As you mentioned, there's different kinds of ways to treat it, but one of the ways is a medication that's highly effective, but could have the risk of being a bit habit forming, depending on how it's, used. And there's sometimes this kind of skepticism that there are individuals in the general public that are seeking these medications, kind of in the sense of using them in performance enhancing ways or trying to leverage side effects of the medication for their benefit. And so as a psychiatrist that's doing these formal assessments and treatments, what would you say to individuals who kind of feel like, hey, this ADHD thing, I don't know about it. Like if it's really kind of something that's real, I think people are just looking for this medication.
Yeah, I think that's where that clinical interview really comes into play, and actually working with someone who's actually spending time with the patient. Like, again, it's not just the questionnaire, because the issue with just the questionnaire is that it's just covering attention, concentration difficulties, which could be due to another mental health disorder. So again, it's not sufficient. So you really do need to work with someone who is listening to someone's entire story. Of course, there are some people out there who are seeking medications. And one of the ways, like I, again, help to figure that out is that when you're working with someone who really does have the diagnosis and they're suffering, they usually are understanding that it's going to take more than just one visit to kind of really come to a decision around what their diagnosis is, and then how they are engaging with treatment. And so I think a lot of this, the onus is on the practitioner to really do their due diligence. Again, talking with the patient, talking with any kind of social connection, so family or friends who have been able to observe the patient, and then being honest with yourself as a clinician, like what you think is going on, and being able to communicate that effectively to someone else. Because I do have people who come to me thinking they have ADHD. And again, maybe they have anxiety. And sometimes they have said like, oh, you think it's just anxiety? I'm like, well, no, it's not just anxiety. Anxiety can be very impairing as well. And it's something that we also have to address. So it's not that like ADHD is like, oh, you don't believe me and that type of thing, but it really is like, you really do need to have these symptoms dating back prior to the age of 12. And if you don't, it's probably not ADHD. Again, unless you've had some type of traumatic brain injury, which is managed a little bit differently anyways, if it's an acquired kind of ADHD, but otherwise we don't really see that as much. So I'm pretty thorough in terms of my evaluation. And a lot of times people who are medication seeking, they don't want to see me because it's going to require a pretty good amount of effort in terms of getting that actual diagnosis.
And then I just had a question, as you work again with women, and as women go through life, as you talked about the hormone kind of fluctuations, their body changes. So from, they might have ADHD, let's say diagnosed as a child, a teenager, and then they go through their young adult life, and then they go through reproductive life, and they go through perimenopause and menopause and so on. Yeah. As you've worked with adults, do you find that your kind of treatment of ADHD might shift depending on what stage of life they're in, even if you're working with the same person or you get a new patient, but does it influence how you kind of treat the ADHD and also like symptoms you look for and things like that?
Yeah. So one big thing in terms of the hormonal relationship with ADHD and women is these estrogen dips. So in a woman who is reproductive age, oftentimes like right before your menses or your period starts, you have this drop in estrogen. So historically, we have heard of premenstrual dysphoric disorder. So people get more depressed, about a week or so before their period. But we're also a research article came out, I believe last year, showing that women who have ADHD start to have more cognitive issues during that particular time of the month. And the same thing essentially is what's happening in the perimenopausal period. So you're starting to eventually go to a point where you're not going to be producing estrogen out of the ovaries. And so during that perimenopause phase, a lot of women start to struggle more with ADHD symptoms as well. And then the same thing right in postpartum, you have this huge drop off in estrogen. So how we approach that is different. So I would say in the reproductive age prior to, you're not like currently pregnant or in that postpartum period, you kind of treat ADHD generally the same as you would, in a male population, right? So again, stimulants, non-stimulants are the options. When a woman becomes pregnant, we usually do have a pretty thorough discussion around like ADHD medication options and in terms of kind of the risk to the fetus during that time. But we also weigh that against how severe are your symptoms without medication. Because what we know is that if you have pretty severe ADHD and it's not treated, that also is a risk to the pregnancy as well in terms of your overall well-being, taking care of yourself, and so on and so forth. And so for some women, it is like they're okay with stopping medication during that period of time. But some women, like they actually do benefit from continuing on the medication. That's a very case-by-case basis. And pretty much every reproductive psychiatrist I know says that, like they have to have an honest conversation with the patient around the risks and the benefits of treatment versus no treatment. Also, it requires teaming up with the patient's OBGYN so they understand what the options are, what are the things that we're going to keep an eye out for during the pregnancy. Because unfortunately, there are still a lot of clinicians out there who will say, during this period, you just don't take your medication, which is not a good idea. Yeah, like, which is not a good idea for people who have kind of more severe forms of ADHD. Now, if we get to the postpartum period, that's a whole nother discussion around if you're going to be breastfeeding, what do you want to do? What are the risks to the baby in terms of breastfeeding and utilizing these medications? For a woman who's deciding she's not going to breastfeed during in the postpartum period, again, we go back to that kind of reproductive age decisions and similar, like, if you were on a stimulant before and you want to restart that now, you're welcome to do so. It's pretty much the same. Now, perimenopause, we're learning more and more how beneficial HRT is, or hormone replacement therapy. So what I usually tell women is this. During this phase for hormone replacement therapy, I recommend talking with their OBGYN about that. That's not my wheelhouse. There are some reproductive psychiatrists who do choose to provide that treatment as well, but I just currently don't feel comfortable doing that. And then what I do is I'll work with someone who's seeing their OBGYN around HRT, because again, is it safe for you to take it? Is it not? Hopefully they can work that out together. But I am familiar enough with the hormone replacement therapy to know what are the side effects, what are the benefits of these hormones, and then make adjustments to people's medications. So what we'll then do is like still treat the ADHD on top of like them receiving hormone replacement therapy. Now, say a woman comes in and she's never been diagnosed with ADHD during this time period. We then have to then do a lot of kind of history gathering. Again, did you have symptoms as a child? And sometimes, no. They did not have symptoms as a child. These are all new symptoms during perimenopause. Well, in that case, I would say that's not ADHD. That could just purely be perimenopause and cognitive kind of like fogging that people experience. And in that case, I think hormone replacement therapy is the most appropriate option. If they're having any mood symptoms or things of that nature on top of already receiving hormone replacement therapy, I will provide like treatment for that as well. So that's how I kind of like map things out for a lot of my clients. And it does sometimes mean during perimenopause, we have to make adjustments to the dose of patient stimulants as they're getting that hormone replacement therapy treatment, because that treatment in itself can take anywhere from like kind of 1 to kind of 3 months or so to really see the benefits of it. And that's like if you get the right right dose right away and then someone's stable on it. If that's kind of changing during that time, it can take a little bit longer to sort out.
Wow. So it sounds like it's definitely the kind of thing that if a person really was concerned about, talking to a specialist is really, really important, that it shouldn't be taken lightly, that they should really work with someone that has some expertise in knowing kind of the ins and outs of how to treat ADHD in different stages of life. And for, women that are listening or watching this podcast, if you are worried about whether or not you might have ADHD, if you are listening and you're hearing about what executive functioning is and thinking, gosh, I'd like to be assessed for that, there's definitely ways that you can find people in your area to help you. And if people, Dr. Greenlee, people have kind of questions for you or just want to reach out and kind of say, hey, how do I find a specialist? Or, what should I look for? What kind of questions should I ask my doctor? Is there a website that you have that people can maybe check out?
Yeah. So if you want to learn some more information, you could check out my website is bloomandbuild.com, as well as I'm on Instagram as Bloom and Build Psych, where I talk about like ADHD and living with ADHD and what that might look like. And again, if there's additional kind of like ADHD resources that I can mention, I would definitely say checking out Russell Barkley's YouTube channel is pretty awesome. Like he's decided that this is his pay it forward stage of life. So everything that he's pretty much done in the past in terms of lectures is online. And he even does respond to people's questions in his comments as well. So those are the two resources I would highlight.
Okay. And then as we wrap up, I always ask guests at the end of the show, what are 5 things that you do to support your own mental wellness, just in general?
So for me, there are a few. So one, I would say physical activity. I found that that's had a huge impact on my mental health. And I've even started doing like heavy weightlifting. And I'm actually a part of an app that I didn't mention earlier. It's called Minovation, which is a perimenopause app for women who want fitness exercises as well as educational videos as well. Next, I would say nutrition. I try to eat healthy most of the time. And then third, I would say is like really my social connection. So spending time with my family, my friends, getting out the house, I think is incredibly important. And so then the next one I would say is being outdoors. Like I love being outside and having I just love plants. I always joke that I should have been a botanist. And then lastly, I would say for me, it's just spirituality is really important and taking time to self-reflect and really kind of sit and meditate or even in going into prayer. So those are my five.
That's great. Well, thank you so much for being on the show. I hope that listeners out there really kind of took in a lot of what you had to say. And for those of you listening, thanks for joining today. I hope that you have a wonderful week. And I'll put the link for the website up. So check it out and have a great week, everybody.
Thank you.